Hi everyone, my name is Brittany Byers and I'm going to talk to you today about blood pressures and some of the disorders that can go along with blood pressure. First thing is a normal blood pressure for an adult is 120/80. Now the top number is known as the systolic number and the bottom number is known as the diastolic number. One way to remember this that I personally use is the diastolic number starts with a D, so D down. We'll go into some of the disorders that go along with blood pressure. Some of the disorders that go along with blood pressure are hypertension, which means high blood pressure, and hypotension, which means low blood pressure. Now, hypertension basically means that either the top number or the bottom number, that's the key word, not both of them, one or the other, or both, is above the hypertension range. So, for example, if a blood pressure is 142/60, that is hypertension, even though the bottom number is not in the hypertension range. And another blood pressure example would be 120/94. Seeing it's above 90, it's hypertension, the bottom number. Hypotension is low blood pressure, like I had just stated, and that means that it would be 90/60. So if the blood pressure was, say, 90/58, that's hypotension. Or, say, 120/42, hypotension. Now, with hypertension, that makes the individual more likely to have stroke, heart attack, or kidney disease. So, pretty much all major things. Now, the only way a person is going to know if they have hypertension is if they have their blood pressure taken. There is no symptoms that correlate with hypertension. Hypotension basically makes patients feel very dizzy, they can faint, just a really uneasy feeling. And once again, they're only going to know if they have their blood pressure taken. Now, normal range for an adult is 120/80. So, most people, when they have their blood pressure taken at the clinics, you need to make sure that they haven't ran a marathon or anything before they came in. Ask the basic questions. Have you had a cigarette? Have you been running late, ran in here? You need to know all the factors of the individual before you take the blood pressure so it's accurate. And another thing, major important thing, is the cuff size. Here is a blood pressure cuff. This is a standard one. And this basically is used for most adults. Now, as you can see, it says adult size, and it needs to be in this range when wrapped around the patient's arm. Now, if it's out of this range, that means the cuff is too small, and you're going to have to go to the size that's larger. For example, if the cuff is too large, you're going to know because it's going to be way too loose on their arm. So make sure you have proper fit for proper accuracy in blood pressure. Now, another thing you're going to need when taking in blood pressure is a stethoscope. And I have a Littman stethoscope here. And one thing about stethoscopes is you're going to have to remember is to make sure that the earpieces are facing towards your nose. Now, one common misconception with this is someone looks at this stethoscope and they see them pointing this way towards their nose. They're going to put them in like this. They're not going to be able to hear anything. Now, when I say towards your nose, I'm meaning because your ear canals come towards your nose, you're going to want the earpieces facing like this. So you're going to want them facing more like outward, but the common terminology is facing towards your nose. So you're going to put them on your ears like this, and that's the proper use of a stethoscope. Now, the stethoscope is a tricky instrument at first, but with more practice, it becomes second nature. So to take a blood pressure, you're going to need the stethoscope and you're going to need the blood pressure cuff. The blood pressure cuff has the mechanism that is for mercury, and it goes by even numbers. You're never going to have an odd number for blood pressure. And the only way you'd have an odd number is if it was like an electronic blood pressure, not one like this, but a measuring device that's electronic. A lot of the clinics do use them now. That's when you'd have an odd number. But with these, you will never have an odd number. If you've had an odd number, you have measured wrong, or you're reading it wrong. So basically what the healthcare provider will do is first, to do an accurate blood pressure, you need to find the radial pulse. The radial pulse, if you look at your thumb, you'll come down your thumb, and in this groove right here is where the pulse will be. And mine's right there. So you're going to keep this on the patient, and you're going to wrap the cuff around the patient's arm. So you'll wrap it around, tighten it securely, make sure that everything is where it needs to be. It's going to need to be 1 inch above the brachial artery. The brachial artery is right in here. So you're going to have the cuff up in here. And to find the brachial artery, a tip is hyperextend the arm like this. And you're going to work your way in slowly until you find it. And there's mine. And you're going to know where to put the blood pressure cuff, because right here it says artery and there's an arrow, and you're going to have to line it up. I mean, it's not going to have to be perfect, but you know, in the general ballpark area. And after that, then you may find your radial pulse again. And what you're going to do is you're going to pump the blood pressure cuff to 80. And you're going to feel for the radial pulse still. You're going to keep pumping up 10, so 90, 100, 110, 120, until the radial pulse, you can no longer feel it. You're basically cutting off the radial pulse. Then, when you find that number, and for example, with me, it usually is about 100, because my blood pressure, my top number, is going to fall in the 100 area normally. You're going to add 20 mercury levels to that to be able to know where to pump the individual up. So, most of the time, I will be pumped up to about 120. So, for example, if you stop feeling the radial pulse on a patient at about, say, 110, you're going to pump them to 130. So after you've done that, and you found the number, you're going to add 20. So then you're going to find the brachial artery again, and you're going to find the pulse. Once you find it, make sure you hyperextend the arm, because it's way easier to find it that way. You're going to put your stethoscope, and one way to hold it without having outside noise when you're listening is like this, just like a V. And you have so much control with such little amount of force on it. And you're going to put the stethoscope on the area of the pulse. And then what you're going to do is you're going to puff the blood pressure cuff, say, to 130. So you have only 2 cords that you're having to manipulate, but you know, at first it's very awkward. And so you're going to have your stethoscope on, and you're going to have the stethoscope on their brachial artery. And basically what's going to happen is you'll pump up to 130. You will release by 2 notches per second. And what you're going to start hearing is the 5 phases. Now you only have to worry about phase 1 and phase 5. Phase 1 is going to be the systolic number. So